So I'm often asked, what is the current state of the art of medically supervised weight loss? We've seen a few papers published nationally in the peer-reviewed medical journals talking about surgery when compared to intensive medical therapy, and people have asked, what does that really consist of? In our view, what that consists of is a multidisciplinary approach that takes the best science available and applies it to a personalized individual plan for that person to lose weight and keep it off. There are a few things that have happened in the last few years that have made us more successful in that battle. It's still an uphill fight once the body mass index has crossed over 30 or certainly 35. But in many people we can make some difference and we can see some long-term success. Some of the new innovations have come from the recognition that the body has a physiologic set point. You might think of this as your body's home thermostat, and when the body weight falls, systems kick in with hormones and metabolism that tend to push the body weight back up. So we have to counteract that in many ways. The best way is through regular sustained exercise, which means 30 to 60 minutes of walking every single day. In addition, there are 2 new prescription medications that are available that were approved by the FDA in 2012. One of them is called Qsymia, and it has good data in trials lasting a full 2 years that show people lose modest amounts of weight and improve their blood sugar control. The second drug is called Belviq, and this too has data that lasts 2 full years with people taking the drug every single day that shows somewhat more modest but still successful weight loss across the board in patients, also with some improvements in blood sugar and with lipid control. So these are a couple of new weapons in the battle that we have. In addition to that, there's good data that emphasis shifting the diet toward protein and moving away from carbohydrates is very helpful at producing a better sense of satiety and more sustainable weight loss results. The carbohydrates in particular are increasingly recognized as having very high glycemic index, pushing us towards more insulin secretion in the body, more fat deposition, and resulting more hunger and more weight gain. So by interrupting that cycle, we really need to shift away from the carbohydrates. Lastly, the best integrated medically supervised weight loss program also involves a psychological aspect and some coaching and counseling regarding eating behavior and battling our demons that push us toward those comfort foods. So together, across the board with exercise, with diet, with counseling, and with medications, we can make a difference, whereas a few years ago it was a more of an uphill battle. We employ these same methods and use all of those same tools when helping people keep their weight off after weight loss surgery as well. Our view is that this is a very difficult fight and it takes all aspects, a coordinated effort using every weapon in our arsenal in order to be successful for the long term.